Hi, my name is Augusto. I'll be your nurse today. I'm going to close this curtain for some privacy. Can you tell me your name and date of birth?
Maria Rojas, 32162.
Alright, so today we're going to be doing a head, eyes, ears, nose, and throat assessment. Is there any safety concerns for you or myself?
No, thank you.
Okay, so this assessment involves me touching you. Is that okay?
That's okay.
Alrighty. So I'm going to begin by starting with your head. I'm going to be inspecting for hair distribution, any parasites, any lesions or redness. I'm going to be palpating for any deformities, any contusions, maybe any masses or lumps. I don't feel anything, any pain. Head feels appropriate size. Alright, so next we're going to move to your eyes. So just look at me. I'm going to be checking the external eye, checking eyebrow and hair and eyelash distribution. I'm going to be checking the external eye for any discharge, redness, or lesions. Alright, next we're going to take a look at just a conjunctiva. I'm just going to pull down with my thumb. Look at me. Alright, checking for any redness, discharge, or foreign bodies. Perfect. Alright, so next I want you to follow my pen going in and out, okay? Alright, so that was checking for accommodation. Look straight forward at me. Alright, we're going to check for pupil constriction. Perfect. Alright, so next we're going to see how your eye muscles work. Follow my pen. Alright, that's our 6 cardinal fields of view. Okay. Alrighty, so then I want you to read that Snellen chart for me. Alrighty. Alright, next we're going to move down to the ears. Alrighty, so I'm going to look at the external ears. I'm going to be taking a look at the size, shape, and position of the ears. I'm going to be checking for any tenderness by pulling on the pinna of each ear. Any pain?
No.
Alright, I'm going to pull on push on each tragus. Does that hurt at all?
No.
Okay, so I'm going to be looking at the ears again for any excessive cerumen, any discharge or lesions, possible foreign body. Same over here. Alrighty, so I'm going to plug one ear. I want you to repeat what I say, okay?
10. 5.
Okay. Alright, so our next step is going to be, we're going to move down to the nose. So, you able to lift your chin up for me? Alright, so I'm just checking the general shape of the nose, make sure there's no deviations, lesions, discharge, or redness. I'm going to check the septum to make sure there's no septal deviation. I'm checking the nasal mucosa for any redness or swelling. Alright, so next what I'm going to do is I'm going to plug one nostril. I want you to blow out of the other. Awesome. Okay. Next, we're going to be checking out the mouth. So I'm just sitting how you are. I'm going to be taking a look at the lips, make sure there's no dryness, discoloration, redness, or cracking. Alright, I want you to do a big smile for me. Alright, opening up your mouth. Alright, so I'm checking the teeth for any dental work, any cavities, any missing teeth. Everything seems to be okay. Alright, next we're going to check the gums. So I'm just going to pull down here. Okay, no bleeding, no discoloration or lesions on the gums. Alright, stick your tongue all the way out for me. Stick it out. Okay, tongue seems midline, no discoloration, proper moisture, no cracking or dryness. Okay, alright, awesome. So open up your mouth real wide for me. Alright, we're checking vagal nerve here, making sure that the uvula is midline, as well as the tonsils, which are negative for any exudate or swelling or redness. Great. Alright. Almost done. So our last step is I'm just going to check out your neck, okay?
Okay.
So I'm just going to make sure your neck is midline. Check the posture and shape of the neck. I'm going to palpate for any masses, any tenderness. Does this hurt at all?
No.
Okay. So next what I'm going to do is I'm going to reach around. Swallow for me. I'm feeling for the thyroid. Does not seem enlarged. Trachea seems midline and non-deviated. And last to finish up, I'm going to be feeling your lymph nodes. So I'm going to check under here. Does that hurt at all?
No.
Alright, that's submental, submandibular, tonsillary, preauricular, postauricular, occipital, anterior cervical, and posterior cervical. Alright, so I didn't feel any swelling. Did any of that hurt?
No.
Alrighty. So it seems like we're done with our head, ears, eyes, nose, and throat assessment. Do you have any other questions?
No.
Alrighty. So here's your call light. And thank you.
Thank you.